So let's take a look at contraception. We have the IUD, which is a plastic or metal device which is inserted into the uterus and convinces the body that it is pregnant. This because the body does not want to get pregnant twice, prevents any implanted fertilized egg or any fertilized egg from implanting. We've also talked about tubal ligation and vasectomy. So let's take a look now at some of the other options. We have coitus interruptus, and in this situation, what you do is you stop having sex just prior to the male ejaculating. This is not very trustworthy. It requires that you have the state of mind to be able to withdraw at that point. So it is very unreliable. There is the rhythm method, which is fertility awareness, and what we're looking there is avoiding intercourse during the period of ovulation and fertility. This requires some planning. You can do it by recording the basal temperature because the body temperature rises after ovulation, or you can go by a calendar method, and what you do is you see that periods start 14 to 16 days after ovulation. So you can calculate your ovulation time by working backward from your last period, provided that your periods are consistent. So say your periods are on a 28-day cycle and your period begins on day one. Your period's going to last, say 4 days or 5 days. So we'll say 4, and in that situation now, you've got 10 to 16 days before ovulation occurs. Now, you need to avoid intercourse for 3 to 4 days before or after ovulation. So basically, a week after your period ends to 2 weeks after it ends, you should avoid sex. Now, the problem with this is that during that period of time, when you are most fertile is the period of time when you most want to have sex. The body tricks you. So it makes you want to have sex yourself more during that period. It also makes you more physically attractive during that time by subtle modifications to the body. Increase in breast size, increases in blood supply to the tissues, so you look more vigorous, more young, etc., etc. So this is not a reliable method at all. Now, some other things that you can do. You can terminate the pregnancy. This is abortion. And then there are miscarriages, which is a spontaneous abortion, which is common and frequently occurs before a woman knows she's pregnant. So a woman may miss a period, not really be sure that she's pregnant, and then the next period comes and she's fine. And this happens quite a bit, actually, because the body very quickly can determine whether it is a viable child or not, and it will expel anything that it doesn't feel is viable. There is something called Plan B, or the morning after pill, which prevents fertilization of the egg. And then there's RU486, which is mifepristone, or the abortion pill. And this is used, for most abortions. This induces a miscarriage during the first 7 to 10 weeks of pregnancy. Now, because of timing issues and everything else, it is possible to be pregnant and not know you're pregnant for 6 to 7 weeks. So, having an abortion prior to that period of time is difficult. You can basically, you're not going to miss a period until you're 2 weeks pregnant anyway, and you're not going to be sure until 4 weeks after that when you miss your second period. And so that 6-week window is a little tight there. But mifepristone is used to induce a miscarriage in 7 to 10 weeks. Oh. Okay, so here are just some of the birth control methods that are possible. We've got the IUD, which is placed in the uterus, convincing that the cells, that there is a pregnancy already occurring. The progestin, which is the implant, a diaphragm, which will block semen from going into the uterus. The same occurs with the cervical cap. We have condoms, which prevent the release of semen into the vagina. Again, these are not terribly, they're about 97% effective. Some of the conditions of the reproductive system that occur. With men, there is benign prostatic hypertrophy, and about half of all men over the age of 50 are going to experience this. This is a swelling of the prostate gland, part of the reproductive system, and it happens that the urethra passes through the prostate, and when the prostate expands outwardly, it also expands inwardly and tightens around the urethra, making it harder for men to urinate. There is prostate cancer, which is relatively common. It's in about 13 out of 100 men. It is very treatable, and in fact, there is often a wait and see process to observing what's going on. Testicular cancer is relatively rare in men, at 1% of the men out there getting that cancer. Nonetheless, 1% seems a relatively high risk, so you can do manual examinations of the tissues to look for any lumps or irregularities. With women, there's endometriosis. Up to 10% of the women out there will have endometriosis. This is can be a very painful situation, and we'll talk about that more in a few minutes. We'll talk about breast cancer, but there's a 13% risk of breast cancer. We've got cervical cancer, which hepatitis, or not hepatitis, but human papillomavirus is responsible for about 99% of those cases. And ovarian cancer, which hits about 1 in 70 women. Now, benign prostate hyperplasia, general enlargement of the prostate gland, and often comes with age, leads to increased retention of urine and increased frequency of urination with reduced output and strength of stream. Diagnosis, if you have frequent urination, 8 or more times a day, for instance, a digital rectal exam, where the physician can feel the prostate gland through the rectal wall and prostate-specific antigen or PSA test. Now, benign prostate hyperplasia is easily treated. There are a number of wonderful wonder drugs which are able to withdraw, to reduce the size of the prostate to allow for urination. Testicular cancer, compared with other types of cancer, testicular cancer is still relatively rare. Testicular cancer is the most common cancer in American males between the age of 15 and 35. Testicular cancer is highly treatable, and that is part because there is a testicular blood barrier. Just like there's a blood-brain barrier, there's a testicular blood barrier which prevents materials from passing on into, or cancerous materials from passing on into the body in general. Signs and symptoms of testicular cancer include a lump or enlargement in either testicle, a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, sudden collection of fluid in the scrotum, pain or discomfort in a testicle or scrotum. You can also see enlargement or tenderness of breasts in men and back pain. Endometriosis is where you have endometrial tissue that is located outside of the uterus. It responds like other endometrial tissues in that hormonal changes during the reproductive cycle can cause it to expand, it can cause it to bleed, etc., etc. There can be painful adhesions. Now, I've heard of a situation where a woman had endometrial tissue actually located in her nasal cavity, and as a result, she developed nosebleeds every time she had her period. So this stuff can end up in any of a number of unexpected places and can cause some significant pain. Breast cancer impacts about 1 in 10 women. I think it said 1 in 13 earlier, so we're in that 1 in 10 to 113 range. But 1 in 10 are affected. There is a gene that is associated with this. It's the BRCA1 and BRCA2 gene mutations. Some other things that can come into play that increase your risk of breast cancer include alcohol consumption, a sedentary lifestyle, and hormone therapy for menopause. So it is not unusual for women to take estrogens after menopause to maintain bone structure. Unfortunately, the increase in bone structure runs the risk of a decrease or an increased risk of cancer, breast cancer. Some things that will diminish the risk of breast cancer, including breastfeeding. Moderate to vigorous physical activity is linked with lower breast cancer risk. The more children you have, the less likely you are to develop breast cancer. That has to do with the hormones that are produced, and during pregnancy, your hormones are not being produced at the same level, so you are more likely or less likely to develop cancers. Decreased alcohol consumption, delayed onset of puberty. So instead of having puberty at 11, if you have it at 13 or 14, that comes into play. Early onset of menopause is a possible difference there. And again, that relates to how much of certain hormones you are getting into your bloodstream throughout your life. Now, cervical cancer, actually this is a good place to stop. We will pick up on cervical cancer in our next presentation.